Hello, I'm Lori Preston from Bluegrass Community Foundation. We hope you join us on March 28th, Wednesday, for On the Table. What is On the Table? It is a community-wide conversation where your voice matters. It's very easy. Just go to www.bgcf.org/on-the-table. There you can find all sorts of information on how to have a conversation of your own. Conversations can be about anything, what you love about your community, what you want to see improved about your community. It can happen at a place of worship, your business, in your home. It can even happen on the sidewalk, in a park. It can have just a glass of water or a catered lunch. It doesn't really matter. The important thing is that you talk about your community, what you'd like to see improved, and then how you want to make it happen. When you're finished, you simply take a survey. And the easiest thing you can do is text 797979 and text OTTKY to that number. There you'll get your survey on your phone. And when you get that survey, it's super short, super easy to take, and you can give feedback to the community. That information will be then collected and it will be given to decision makers, the media, Fayette County Public Schools, and across the region to help people make great decisions about our communities, region-wide. So we hope you join us on March 28th. And now you're about to see a conversation that is happening among city leaders here in City Hall in Lexington, Kentucky. Take a listen.
Okay, so let's go around the table and introduce ourselves to everybody who might be watching.
All right, Battalion Chief Lee Hayden with the Lexington Fire Department.
Hi, Ashley C. Smith, Director of Education and Governmental Affairs at Fayette Alliance.
Hi, Missouri Suarez with Partners for Youth.
Jennifer Warnwell with the Lexington Fayette Urban County Government.
I'm Polly Reddick. I'm the Director, Office of Homelessness.
Colleen Hall, Director of Community Engagement for the Lexington Public Library.
Julius Johnson, Director of Reentry Services, Lexington Rescue Mission.
Thank you all so much. I'm Jim Gray and I'm Mayor, and I'm happy to be with you all today. So what I thought we might talk about first is sort of an easy topic, but something that I always find everybody in Lexington's interested in, and that is parks and how they're used today, how we might adjust and change and improve them. And anybody got any ideas on that?
I'll start if you want.
You got a little one.
We have been for about a year now working on a Parks Master Plan that you will all see very soon. Both the public and the Urban County Councils had sort of a sneak peek. Lots of community engagement with that project. We've been out in numerous neighborhoods. The Executive Committee and Monica Conrad, the Parks Director, have gotten lots of feedback, both online, in person, and snail mail, I suppose you could say. So we're excited to show you all sort of what that master plan is going to look like, what it's going to recommend for different areas of our community. Where are we lacking in programming? Where are we doing a good job? So I'd be a little bit interested to sort of hear what you all think of that prior to us releasing the master plan. So if anyone has any thoughts.
Well, the library has a really robust partnership with Parks and Rec, and we just deployed tiny libraries in 5 different parks across the city in conjunction with Monica and Penny. And we are also working with them to get a tiny library on the Park and Play van. That is the mobile unit that the Parks and Rec has. So we are trying to figure out a way to get it to be sort of a bookmobile and a Parks and Play van. So we hope we can get that ready for the summer. So we found them really easy to work with.
Great.
I'd be interested to see the park system be used as a resource for community gardens, especially in neighborhoods that are primarily food deserts. So how can we work together in collaborative ways to address food insecurity using that green space as infrastructure?
That's right. And going off what Ashley said, I think we need it's great that we're having this conversation among us who, have an input in communities, but I think taking it back to our actual communities and having them give us feedback on what that looks like, because they are the ones that use the parks most of the time. The young people that I work with are the ones that use the park 90% of the time. And so now it's gotten to a point where it's more of a leisure for us to go to the parks, whereas going to the parks for a young person is their safe space. and it's the space where they spend most of the time. So going back to the community, going back to our young people, those people who don't necessarily have a voice on the table most of the time, and letting them know, what is your input in this? This is the idea that we have.
I like the way that Georgetown, Douglas Park did the entertainment nights. I think it'd be nice to maybe look at each neighborhood parks and see what kind of entertainment they would like to have that's unique to their neighborhood. I know in Douglas Park they did the jazz nights and the gospel nights. Maybe in Cardinal Valley they might have like a Latino music night or something like that. Just something that's unique to their community. That maybe if somebody living this side of town, like, I wouldn't mind let's do some Latino tonight. You know, they can go.
That's right.
You know,
Program.
just
Yeah.
visit some different.
Focus on the program.
Yeah.
Yeah.
We did hear that when we were out in the neighborhoods, when the consultant was out, some of the parks that are being used passively, perhaps the neighbors would rather see some activity there, some programming there, and then vice versa. There was some programming that was doing so well, they'd like to see it, take Moon Dance, for example. They'd like to see sort of that sort of programming on another side of town, so.
Yeah, that sounds like all good ideas. So, Missouri, tell us, everybody may know, but everybody may not know about Partners for Youth. And I love your program. I love what your predecessors have done, those who came before you, and what you're doing today. Why don't you share?
Yeah, so
Because not
something kind of
everybody-
like going back and taking, over the park. So we started this thing 4 years ago. It's about to be 4 years now, called Adopt a Park, where we had our community partners in the Cardinal Valley area come to us and say, our students are afraid to go to the park. I have one student who sees drugs and there's gangs. And so with the help of our partners and the help of the council office, Peggy Henson, we collaborated and we took over the park. And so we had different organizations. We had Partners for Youth, we had the police, we had the library, adopt days throughout the month. And so we started off taking one month. So we started adopting the month of June, and we did 2 weeks out of that. And we saw about the first month 84 kiddos, the first year that we did it. And then fast forward last year, we did it both months. So we did June and July, and it was the first time we've ever done that. And it was amazing because we served over 180 kiddos. And we were able to provide them with a skateboard. There was a recent skate pad that was built in the Cardinal Valley Park, and nobody was using it. And so it was great to communicate with the young people and say, hey, we're going to provide a skateboard. And now you can go to Cardinal Valley and you'll see those kiddos in that skateboard. And so I go over there all the time because my family loves that park. And so we see young kiddos in their skateboards, and I tell my mom, that's the skateboard. That's what all of our partners did. This is what. And so it's great to see the fruit of that continuing. Not only that, but just the relationships that we've built with these young people. Partners for Youth leads an amazing program called Neighborhood Youth Council. We empower high school students to engage in city government. And we have one particular young man who started with Adopt a Park, and he's now part of our Neighborhood Youth Council leadership team. So it's amazing to see the relationship building that goes into that. So it's been a fantastic
How
journey.
how many in the Partners for Youth today? How many?
Our staff
Well, no, how many are you engaging? through
engaging
Partners for
in,
Youth?
we are engaging, I want to say about 50 or so different community partners. And this is, we have several throughout different areas. So we are in Cardinal Valley, we are in Gainesway, and we are in the West End. And so we are engaging up to 50 to 80 different community partners throughout our meetings. And then our young people, we have up to 35 young people in Gainesway, in the Gainesway neighborhood, and then we have about 15 or so in Cardinal Valley. And so we have a good amount of young people, and this is just the second year. So we're doing pretty well.
That's great. That's great. Polly, why don't you share with us a little bit about, part of the on the table conversations can be about just sharing what each of us are doing and making us more aware of what our colleagues are doing, our partners are doing, that sort of thing. And you've been doing a lot.
So I'm going to piggyback kind of off the youth, because I think something that we were hearing in the last several months is about engaging youth homelessness. They seem to disappear into the system and then they get caught and end up in kind of your area of expertise. So how can we better engage them under the age of 24 to kind of set their life on a different path? So we are starting to develop a youth action board that's made up of both currently homeless youth and also past homeless youth individuals that may be over the age of 24, and also college students and high school students, and just kind of getting their feedback on how we can better serve them and engage them and where we need to go to get them more involved so that they don't disappear into a park or into the juvenile justice system, and how we can kind of engage them and turn their lives into a different direction. So that's kind of what we're focusing on right now in my office, which brings in Partners for Youth and kind of some youth activities that are going on in town.
A lot of good work going on. A lot of good collaborative work going on. I think so. Of the Laura Hatfield, who was director. Was it director title? Yeah, that's it. Laura Hatfield, who was director of Partners for Youth. She's today the director of our One Lexington initiative, which is bringing so many agencies and partners together to focus first on youth violence. And when what we've learned and what Laura, she took a lot of the skills from Partners for Youth, from the Mayor's Youth Council, to the work with One Lexington. And by doing that, we're seeing some new data, new information being collected, new ways to intervene, new ways to prevent violence. Not going to happen overnight. We're not going to see perfection overnight, but we're like putting a puzzle together. It goes together one piece at a time. And that's what I find so rewarding and so inspiring about the work that we're doing today. I have to escape. I'm going to miss out on learning, but thank you all very much.
We'll fill you in.
The paramedicine project was one thing that I thought I might hear from Lee about.
Yeah.
Because that's that's got a lot of opportunity to it.
It's made a
Kind of
huge
ties into
difference.
Polly.
I was gonna say it's made a huge difference for us. I hope that program never goes away.
It's already
I was gonna say it's gonna grow.
I hope so.
I don't know.
Yeah, tell.
Yeah.
Okay.
Paramedicine program
Mayor.
in a just to briefly explain it recognizes frequent flyers, if you will, or people who call 911 a lot, and what we find out is not certain emergencies that you would deem as a ALS or advanced life type of emergency. It's more falls or just I'm a little under the weather or something simple. But what they do is they kind of intercede. They go and they meet. They recognize who those individuals are and meet with them either at their homes or doctor's office or where they feel comfortable. And they try to find out more of why they're calling. And what they try to do is assist them. And what we're finding out is, like an example, we had a woman who was calling 20 to 30 times a month.
Wow.
And basically it was just for falls. So once we met with her, we found out that she didn't know that she could get a lift to assist her and lift her out of chair, out of bed, stuff like that. So we were able to work with her doctor and caregivers and get her a lift in the home. So that cut down. Now I think she's made 1 or 2 calls in the last month. So that's cut back a lot on that.
Yeah.
So
The whole
yes,
thing is
and
That's
it,
fantastic.
yeah. So it's a great service to the community, and we've the individuals right now. We have 2 that are heading up, and that's Lieutenant Seth Lockard and firefighter Owen Branham, and they've gone out to other departments and see how they do it. And they quickly said, yeah, this is something that's going to be around for a while, and it's a necessary service. And I understand, it's easy to understand that, if you can get somebody's situation or issue taken care of at a small level, it cuts back on the runs and the wear and tear and things like that of the apparatus and the men and women online, because you're taking care of that small situation and handling it right there, and taking that out. So Band-Aid, if you will, but it's helping us out a lot because it's cutting back on some of the runs, and that's not what we aim to do, but it's helping those individuals get the health care and the need and what they need in the home, so they can have a better quality of life at home or wherever they tend to be. So it's a great program, and we've already talked about it. We know it's going to grow. 2 people can't handle the size of Lexington, and we know it's going to grow. So it's going to take collaboration with hospitals and different things of that nature. So, and they're working on it. They're diligently working on it every day in the office, and we just happen to be in the same office. So I see how hard they work, and their hours. You can't really put their time on their hour. You can't say 8 to 5 because they're or whatever. They're sometimes they get called in the middle of the night, and technically at that time they're off duty, but they go and they facilitate and take care of those things in the middle of the night if they have to. So it's a needed program, and like I say, I very well see it growing in the future with a lot more personnel directed towards that, because it is something that helps the community. And if you can give a person peace of mind at the house, and you can't put a price tag or anything on that, to give them a better quality of life.
So Lee, did you see a need for this based on the amount of run volume, and so you did some research what other communities, how did it sort of transpire?
Our department saw that we watched as the numbers of EMS runs were increasing over the years, and one of the things we do, you create a run report and all that stuff, and we saw that not all the runs were blood or gunshots or whatever.
Sure.
Some were small things of, like I said, sickness or falls or things of that nature. And we found that, and we target those who call often. And when you see that the same person's calling, and it's for, I hate to say minor issues, but issues that, you might not necessarily need a ambulance going lights and siren through the city, putting people in danger, if you will. We saw that, we recognized that, and then we did. We researched, and then you found that other departments were doing this.
Okay.
And said, "Ooh, we need to find out more about this." So between those 2 gentlemen, administration, they researched it, talked to a number of people before we jumped on, of course, presented it to the city, and that's something they approved. And we went and rode with these different departments and found out more information and realized that's something we need. And that's what we were looking for, that answer, and
That's right.
we found it, you know. So,
And from my perspective, I just want to give them kudos. So the one thing that I appreciated, kind of the same thing as on the table, sitting around and you have an issue, but one thing that they did was they used data and kind of looked at where their runs were, who exactly they needed to target. So it wasn't like this open program where anybody could kind of get enrolled. It was, these are our 30 people that call us 30 times a month, or this is our emergency shelter that we're at 8 times a day. And so that's where they have focused, and it has made a massive impact just in the population that I represent, just because, and I'm kind of like, you don't want to say minor, but we know some of those calls were just because a guy ran out of medication. So that's very easily remedied with a phone call or one trip to the doctor. So, and I can appreciate somebody taking the time that they did to really research and really pull out the data and really target for the biggest impact of that investment. So I'm glad to hear it's going to stay around and grow, because it's made a huge difference for us.
So I got a question. So I hear you doing it for like somebody that maybe had a fall. Do y'all do the same type of treatment for somebody maybe getting the same call for Narcan or over ODing a lot?
now if we see that call coming in a lot, we'll try to figure out. We'll sit down with that person, that doctor, or who is their medical advisor, and try to come up with the best remedy to say, how can we fix this? And we're not doing it to say we don't want you calling us no more. Yeah. We're doing it to, you need help, or what's the best way we can help you as a service? How can we help you help yourself, if you will? So we'll do that for anybody. It's not just for falls or whatever. If we recognize any type of medical issue, we'll sit down with that person and the representative and say, hey, what can we do to help you? Is there anything we can do to help you? And just because what we're realizing, some people just don't know the extent of what they can do, or what they're allowed to ask for, or what they, what's out there available. What the insurance covers. And what I'm finding out from these gentlemen is there's organizations that will help with certain things, aspects of it. So it's more of just how can we help you? Who can we call to help you? You know, it's sitting down to find out. So if drugs is a thing, and it's one of the things we'll probably find out what kind of drug treatment facility will accept you with this or will take that. So we're just trying to see what we can do to help and, like I said, try and give them the best quality of life. Yeah.
Colleen, do you want to talk about some of the things you're doing out in the neighborhoods? Or I know you're doing the little libraries because we've seen them and you mentioned it, but.
Sure. Well, we did the Tiny Libraries first iteration was ones that we worked with community partners like Parks to place. And now on April 21st, we're doing another build. And these are all the applications we got. So we did an application process for the next group, and we got over 40 applications, and we're going to build 20 and put those out into the community on April 21st. Okay. So that'll be the next iteration of that. And so I guess I would say they're all mapped on our library website. So if you have people who want to donate books, tell them to go to the library website and look for the map, and they can go put them in any tiny library that they want, and then get into circulation. So we have some at places where we think people would really like to have access to books. So the whole point of it is to reduce barriers to access. So we started with the Hope Center, their 3 campuses, and Parks and Rec, and Gainesway, and we tried to spread them out where we had partners that we knew could sustain them. Is yours going well?
Yes.
Yeah, good.
I love it.
Okay.
Tell by that smile.
Yeah, she was the happiest person ever.
Yes.
Yeah, so we're doing that, and we're also right now we're gearing up for our summer program, so that will be starting in June, and we have a new person who's programming manager, and it's going to be probably the best one we've ever done. Seriously, it's going to be fantastic. So be looking. It's called Read Y'all. So we have anyone who wants to be recorded, I'll record you because we're doing a montage of people saying Read Y'all. So maybe all of you do it on my phone before we leave, and then I'll have you can help us promote it.
And Colleen, will you all still be doing some programming at Phoenix Park this summer?
Oh yes, Phoenix Forward is still on. Yep, we're partnering with Parks and Rec, and we will be doing a whole slate of programming on Tuesdays, Thursdays, and Saturdays. So Saturdays we'll still be in the park with farmers market, and there's going to be the
Artist market.
Artist market every Saturday, and then some sort of big activities in the park and in the library on Saturday mornings, and then on Tuesdays and Thursdays we're going to have food trucks in the park and movies and activities in the library. So that's just at Central.
Cool.
But,
And last year, that really, just sort of hearing you talk about it, that really brought in people from all over the
really
community.
did.
They had a big map where you could put your sort of sticky bubbles and see where you came from. It was pretty incredible.
It was, yeah.
They were from really all over the county, which was great.
And we transformed the atrium as part of that project into like a play space for children, and it has stayed that way all year, and it's been really wonderful. So that's continuing. It's ongoing and will continue on through the summer. So, and it's moved to the first floor. We just did some rearranging at Central, so some of the play stuff has moved to the first floor, and the books have moved into the Central Rotunda, and I think it's changed. It's helped change us to be more responsive to the community.
So I have a question.
Sure.
We have our board meetings in the basement, and there's that store down there.
The Friends of the Library.
Friends of the Library. Is that in all your libraries or just Central?
The biggest presence they have is at Central, but we
Okay.
do have mini stores at every location. And
Okay.
actually, the Friends of the Library are giving us vouchers this year. So when adults complete the summer program, you're going to get a voucher to go shop at the Friends store here at Central or at any of the locations.
Okay.
And then the children will get an option. So they can choose from, we'll have a card of books that they can choose from, or they can get a voucher to shop at the store. And they get a swim pass from Parks and Rec if the kids do. When they complete, they get a swim pass. Yeah, it's really fantastic.
Yeah, because they're the best kids books, and my sister was wondering if she could just go to the one that she
Anywhere.
didn't have to come down the hill. 'Cause I spoil. I mean, we go down there once a month, and all the board walks out with this stack of books. And we just shop while
It's a
we're
good
here.
deal.
Yeah.
All the locations
Okay.
have that. Yeah. Yep. And they also support the tiny library, so they help keep the tiny library stocked.
Okay.
So.
And Ashley, sort of want to talk about some partnerships you have with the city or what you all have going on at Fayette Alliance?
Yes. So last year, Bluegrass Community Foundation issued grants for those who participated in On the Table. And so we applied for a grant. The program's called What's Next. So really taking the talking points that we shared around the tables and turning them into actions. So we applied to receive funding to support our Citizens Planning Academy, and it's the only planning training course in Lexington, Fayette County. And so what we do is we gather local experts, many found within the LFECG system, so planning, Charlie Martin, different commissioners, and then folks who do private work, such as Ed Holmes, who's known for his small area plans throughout East End and Lynburn, and bringing these people together to really showcase their expertise in what makes up our quality of life, which are the comprehensive plan, the planning commission, the decisions that council makes. So Fayette Alliance advocates for sustainable land use and protecting our agricultural resources. And last year we mobilized around the feedback from the public that stated at this time they didn't want to expand the urban services boundary. So we helped mobilize and energize the citizenry to reach out to their elected official and let their voice be heard. And it was a close vote in November 8-7, but the boundaries stood intact, and now we are closely tracking the comprehensive plan. So again, just really informing folks on what their tax dollars go to pay for, and how they can really be involved in what's happening in the local political scene and in the local planning scene as well.
So to build on what you said, the library's putting a community garden in at Northside this year in cooperation with Seed Leaf.
Okay, great.
So there's going to be a community garden there, and then there's going to be a children's garden out on the patio, and we have a Charlie cart, which is a mobile kitchen that we have, so we can do cooking classes, and so other people can borrow it. So Seed Leaf has already signed up to borrow it for some of their in the garden cooking things, and we'll take it out to Missouri, some of Missouri's events too, for in cooperation with Village. So we'll take it out there to the Village branch and do some cooking. So be looking for it. Mobile cooking cart. We're gonna rename it, but I don't know what the new name is yet.
If anyone has anything creative, you
Yeah.
Instead of mobile cookie cart.
So it's named Charlie Cart because it was started by Rachel Ray, and I think it was a legacy thing for her. But we're starting a whole culinary literacy program called the Kitchen Academy, and so we're gonna, because you can wrap all kinds of things into teaching about food and cooking and shopping and growing things, and so we're starting something called Kitchen Academy, and so the cooking cart is part of that, but we have to come up with some catchy names. So if you got something, let me have it. Yeah.
Send it. I will not have anything.
Yeah.
Oh, no, I'm not a marketing PR wordsmith kind of girl, no.
Yeah. Obviously, I'm not either. I don't have a name.
Out on that.
Googling it.
Yeah.
Well, thank you all so much for being here today. We really appreciate it, and all of the things you've had to say. We'll make sure we exchange emails, and we all sort of will be able to communicate. Sounds like lots of communication already happening around the table. So we just want to thank you very much for being here today.
Thank you.
Thank
Thanks
you.
for having us.
Thank you.
We hope that gives you some idea of what a conversation for On the Table is like. Now, it's very, very easy to have one of your own. You can go to www.bgcf.org/on-the-table, and you can download toolkits that give you all the information about how to have a conversation of your own. You can also register there online to make sure that you get the survey afterwards. Now, you can take the survey simply by texting to 797979 and put in the words OTTKY, or you can go online to that website and click Take the Survey after your conversation. We hope you join us on March 28th and be part of On the Table, because your voice matters. We want to hear your voice, so please join us.